8:36 exactly, and time to be joined by our next guest. He's standing by to talk to us about the dire situation. The World Health Organization reiterates calls for vaccine equity in Africa. We are lagging way behind. And when we look at the numbers, they're quite horrific. Currently, only 3% of Africa is vaccinated, whereas the rest of the world, the middle and high income group countries or first world countries are way ahead of us. So what does that mean for us here in South Africa? What does it mean as far as vaccine development in our own countries are concerned, very especially South Africa, and vaccinating all of Africa? If this doesn't happen, what sort of consequences are we looking at? To talk to us about these issues is Professor Adrian Puren. He is HOD at the National Institute for Communicable Diseases. Good morning and welcome, Professor.
Morning, Julie. Thank you very much for the opportunity to be on your show this morning. Good morning to your listeners, viewers.
Lovely to have you here. A really dire situation we find ourselves in, don't we, as far as Africa is concerned?
Yes, it is a difficult situation. It's a bit uneven, of course, in the sense that I think South Africa has at least had made some efforts to procure vaccines on its own because it has some ability to achieve that objective. So I think for South Africa, we're in a reasonable position with regard to vaccines, but obviously it needs to be sustainable. I think that for many other countries in Africa, which are dependent on the so-called COVAX agreement, where that is, the vaccines are bought for countries and then distributed, that makes it very difficult. And as you said, only if it's only 3% of the African continent or the peoples of Africa that have been vaccinated, that means that this is an ongoing pandemic. I know that we have become tired of wearing masks, the physical distancing, and all of those particular aspects. But it would mean that those then will have to remain for us for a while. And in addition, the way in which we can control variants, we will have variants, but I think the concern are variants where they escape immunity, they worsen the condition, then people end up in hospital and ICU. Those types of scenarios, then I'm afraid, will continue. So alternatives around vaccine production is really a great spur for us to try and address those particular problems.
I'm wondering about the more wealthier countries, the countries in the West. We know that they are way ahead of us as far as vaccinating their populations is concerned. And I also know that it seems at this point in time, South Africa is more than ready and willing to start manufacturing their own vaccines. And the one company that has come on board is Moderna. Let's look at the efficacy of Moderna as compared with other vaccines like Pfizer and J&J, that being the one part of the question. And then also, do we have everything we need from Moderna to go ahead and produce those vaccines? I'm wondering also about bottom line. We're talking about bottom line in profits. That's the reason why possibly other farmers haven't come on board. And they are focused on profits, obviously. But they are shooting themselves in the foot, are they not? Because if they don't assist Africa in manufacturing and vaccinating their populations, this pandemic is going to carry on, and it's going to then obviously spread globally. So why do they not partner with us, apart from profit being the key issue here?
It's a very difficult question. I know that when we started off this pandemic, there was this whole idea of world unity and the whole approach around sharing of vaccines and resources. But you're quite right. When it came down to matters, I think so-called vaccine nation certainly played an important role. Although I think even AstraZeneca, I think, was set up primarily not for profit. So I think that hopefully we will still have some advantages around that. But to come back to your first point around the vaccines, are they efficacious? So Moderna has agreed make access to the vaccines, and Moderna, I think, was one of the first vaccines to be approved. In fact, in terms of first vaccines to show good efficacy of the mRNA. So again, it has a high efficacy, I think, above the 90s, which was extraordinary for a vaccine. So and again, it's been approved in different by various authorities. I don't think it's got full clearance from FDA, but we can check on that. And it's something similar to the Pfizer vaccine. It has a higher dose than the Pfizer vaccine, but is efficacious as is. So I don't think we have any concerns around that. And as you know, the WHO then advertised for hubs, vaccine technology hubs and exchanges, which South Africa was granted that status. I think it was in June or July, where South Africa would serve as a technology hub where we would actually manufacture fully the vaccine and distribute it and provide technical support to other countries as a hub for those countries then to develop their vaccine capacities. But it hasn't been that straightforward. I think, especially around the sharing of all the technology that's available. So I think for now, South Africa still has the capacity for what they call fill and finish. So in other words, the vaccine is manufactured by various manufacturers. It could be Pfizer, Moderna, or Johnson and Johnson, and then those ingredients are sent to South Africa, and then we fill and finish and distribute. But I think it's that next phase which will be really critical. That phase of actually being able to produce vaccines in South Africa, not only for local or national use, but also then for distribution. That they will be critical.
Okay, I ask whenever I do a COVID interview, I ask this question over and over again, and I'm going to ask you the same question. Your counterpart in the United States, Dr. Fauci, has just suggested as early as yesterday that a third booster shot is definitely going to be necessary. Your thoughts on it?
Yes, I don't think that we should dismiss that. I think what I think is important for us in South Africa is I think we still need to. I think that the vaccines have shown efficacy, but there is what is called so-called waning immunity, and I think we need to recognize, especially in countries that have shown this, for example, Israel, the UK, and I see now the United States has certainly published some work around that. So I think it's an important consideration. But I think for us in South Africa, I think the first step, because we are a little along the way in terms of our vaccine campaign. So I think our focus really in South Africa is really to focus especially on the older age groups, the 50 and above age groups, really try and get that group vaccinated. Because coming back to your point, what should we be doing now? And that's the opportune group that we should focus on, because they're the group that are the most vulnerable in terms of having comorbidities and ending up with severe disease as well as hospitalizations and death. So I think we focus on that group, get them fully vaccinated, then focus on the rest of the groups. And by which time I hope that we can then think about not reintroducing, but think about the introduction of boosters in South Africa.
Okay, I'm going to read a press statement from obviously Clayson Monyela, and then we're going to listen to a voice note. I just want your thoughts before I say goodbye to you. It's a short brief. The government of South Africa is puzzled at the United Kingdom's decision to keep South Africa on the red list of countries facing stringent restrictions and high costs when entering the UK. Thousands of families and business people in South Africa and the UK are shocked at this continued exclusion, especially given South Africa's progress in combating the COVID-19 pandemic, as evidenced by the rapid declining infection rate due to robust vaccination programs and excellent science. Commenting on the decision to keep South Africa on the red list, Minister Naledi Pandor said, and I quote, "We firmly believe there is no reasonable basis for keeping South Africa on the red list, and I'm very disappointed," unquote. Minister Pandor continues to say that her department, working with other stakeholders, will intensify efforts to have South Africa removed from the list, and is optimistic that the government of the UK will finally realize that their decision is not harming just the tourism industry, but other the businesses from both countries. Before I go to the voice note, Professor, your thoughts on that?
Yeah, so really, I can't really comment about the British government's decision around that. I'm not sure what I guess, the rationale and decision-making processes are that are involved in that with regard to when we start comparing ourselves to other countries. So I'm hoping that whatever it is that the British government takes in terms of its decision-making, that it then reconsiders where South Africa should be. I think we have in South Africa been very careful in monitoring for the variants that are in circulation and informing both the British government and through the WHO. So I think we have fairly reasonably good systems. In fact, as you know, one of the first severe variants that was recognized in the world was here from South Africa, and our ability to do that. So I hope that those factors will be taken into account, that there's good science, good surveillance in South Africa that will allow us to get off that particular list.
Short answer to my next question, because we do have to wrap up. Are you confident that we South Africans who have been vaccinated are safe to travel to the UK and vice versa?
Yes, I would think that, again, you just need to bear in mind the fact that you do have the vaccine, but you have the risk of reinfection. That's no doubt about it. But however, in terms of the severity of the disease and ending up in hospital and dying, your risks should be smaller as a vaccinated individual.
Professor Adrian Puren, thank you indeed for your time. Nice talking with you. Have yourself a good day.
Thank you very much for the opportunity.
8:48 exactly, news and views right here on Salam Media.
Every 60 seconds,